Hello, everyone. This is Dion, holistic wellness and menopause coach. And today I wanted to talk a little bit about hormone replacement therapy because I do get a lot of questions on that. And this is exclusively to provide information. It's not providing my personal view on this, although I'll kind of slip it in a little bit so you know where I stand on this. But it's more about providing information because I do find that a lot of women are confused about it. Some women are well versed on it, but there are women who are really, a little bit confused in terms of what it is and is it right for them. So this video is really geared toward those women. Just to provide a little bit more information, I am not providing everything. This is not what this is for. It's just a little bit of insight in terms of a little bit about it. So what is hormone replacement therapy, also called HRT, which is hormone replacement therapy? And it's a solution for menopause symptoms. Popular ones include hot flashes and night sweats, headaches, and more. A lot of women opt for hormone replacement therapy because they can't find a better solution for them, or that's something that their doctor recommends and they're open to it. There are other women who are not open to it because they're not they don't like medications really, and that's exactly what hormone HRT is. It's medications, it's hormones that are in the form of a medication. It could be in the form of a pill, a cream, or anything like that, that you either place on your skin or you can take internally. It's mostly for estrogen replacement. Actually, HRT is also called estrogen replacement therapy, or sometimes it's also called menopause hormone therapy. So you'll hear either of those names that it's been called for. And the primary reason why it's also called estrogen replacement therapy is that after menopause, most women's your estrogen decrease. And so that's why you need the extra estrogen to replace what has been removed. And so, who should take HRT? Now, well, let's start with who should not take HRT, right? Because that is probably more important. Now, again, it's going to be a conversation between you and your doctor, but based on research that's out there, people who have a history of blood clots, if you've had any kinds of cancer, any forms of cancer, if you have heart disease or liver disease, heart attacks, if you're pregnant, or if you had a stroke, it's recommended that you do not use hormone replacement therapy at all. And so what are some of the side effects of hormone replacement therapy? Some women may experience bloating, some may have breast swelling or tenderness of the breast, headaches, mood swings, nausea, vaginal bleeding, and there could be more that's not really well documented right now, but those are the ones that are really well documented. Now, how do you decide if this is right for you? And that's going to be a conversation, as I mentioned earlier, between you and your doctor and what it is that you want to accomplish. So if you don't have strong convictions for or against, I recommend you having a conversation with your medical practitioner, because I think it's a personal decision, right? It's a personal thing that each woman has to make that decision for herself, whether or not it's right for her. And just a little bit on where I stand. Now, my first recommendation has always been and will always be natural solutions first. Now, if you've tried everything that you can and you've done your best, then maybe HRT is the best option for you. But I always recommend, at least I've done that for myself and it's worked for me. Lifestyle is very important. Diet, nutrition, fundamental. for alleviating some of the symptoms that we experience during menopause, and also some of those same ones that you experience during perimenopause as well. Supplementation is also important. Managing your stress, which tends to be a root cause of a lot of the symptoms that we do experience. So being able to manage your stress well, and reducing your stress as well. And there are always techniques that you can use in order to do that. Sleep, rest. That's also important. So if you've tried all of these other natural solutions and things on your own, and movement, I can't forget movement, then you can make the decision whether or not HRT is right for you. But just to provide you with a little bit more information, and you could go deeper on your own if you like, but this is just a preview of a little bit of introduction. Okay, until next time, this is Dion, menopause and wellness coach. Thanks for tuning in. Bye-bye.